In today's 2-minute tip for the 30-day challenge, I am delighted to be joined by Paul Tricker, who is an orthopedic surgeon who specialises in knees, and he's based in Surrey in the UK. Now, in today's video, Paul is going to take us through the different injection options available to us if we have osteoarthritis, but with particular reference to what the evidence says about how effective they really are. So it's going to be a corker. Let's listen to what he has to say.
So we're going to have a quick conversation about injections for knee OA, or OA generally. Injections can be either non-biologic, local anaesthetic, corticosteroids as example, or biological injections. This is a newer term and encompasses platelet-rich plasma, or PRP injections, hyaluronic acid injections, or these newer stem cell type injections. There's a fourth type called collagenase injections as well. So they're the types of injections. Where do we stand with these? So let's talk about corticosteroids, by far the most common injection used in the UK. People use hydrocortisone or depomedrone. Okay, so how do they work? Steroids are anti-inflammatory. So an anti-inflammatory injection into the knee, that's what's being given. They're often short-term. People say, how long will they last? Typically 6 to 12 weeks. You don't want to give too many. If you have too many steroid injections, then there is a risk that you can get osteopenia, i.e. reduced bone density around the knee joint. And if you have too many injections, you can also possibly accelerate the risk of arthritis and damage in the knee. Okay, that's more recent evidence, but using targeted injections when required for acute flare-ups or to enable you to do your exercise to help offload the knee joint is a useful adjunct. That's steroids. It's hyaluronic acid. So the theory here is hyaluronic acid is part of the normal joints, and in arthritic knees, the hyaluronic acid changes molecular weight, and by injecting hyaluronic acid into the knee, you might add this correct molecular weight hyaluronic acid. It works as a lubricant, as a gel in the joint, and some people really benefit. This is often good in drier knee joints for mild to moderate osteoarthritis, and there's been some evidence to suggest it can work in patients for up to a year at a time. So platelet-rich plasma, you take your blood, you put it in a centrifuge, you filter out the platelets in high concentration, and you can inject them into the joints and sometimes into tendons to allow healing. There has been some benefit in papers, but again the benefit's been up to about 12 months. Okay, not in all conditions, but in some, particularly with arthritis, but the evidence is still scanty. It's an outpatient procedure. These injections can be done while you're awake, and they're most commonly done in the shoulder joint or the knee joint. We've discussed the common types of injections so far. Corticosteroids, which are anti-inflammatory injections, short-term benefit. Hyaluronic acid or viscosupplementation. They inject a gel substance, a lubricant into the knee joint. Platelet-rich plasma, which is where you take your blood and centrifuge the platelets out, and they're the common ones available in most places. The newer injections are these stem cell injections. These can be originating from bone marrow, from fat, and there's even newer injections that are being from amniotic fluid or even placenta derivatives. The hope is, with these stem cell injections, that they can start the healing cascade in the joint to reconstruct or rebuild articular cartilage. As of now, there is no evidence to support the use of intra-articular stem cell injections from any of these derived sources. I think the future stem cell injections in different parts of the body will be important, and I think it's important that we carry on the research in these areas, because it might well be in the future that we can have a stem cell injection when we're having a heart attack to regenerate dead heart muscle, or the holy grail from an orthopedic surgeon point of view, that we can inject stem cells into the knee joint It would stay in the knee joint, which is important, and also act on the surface to produce new cartilage on the surface of the bones, i.e. regrow that. This has not, and I stress not, been shown to be the case so far. So stem cell injections is very much experimental and unproven at this stage.
Thank you so much for going through that for us, Paul. That really is helpful, and it definitely makes things a lot clearer for me, if nobody else. So if you did find that helpful and you would like to know where you can find Paul online, then two main places. Firstly, you can find him on Instagram, Surrey Knee Surgeon, and there is also a website, surreyorthopaedicclinic.com, where you can also find some more information about how to get hold of Paul. I'll pop a link to both of those in the description below the video. Question of the day: have you had any of the injections mentioned in today's video? And if so, did they work for you? Let us know in the comment section below the video. And just before we go, if you haven't already, consider subscribing and hitting the notification bell so you get notified every time we release new osteoarthritis related help, so you don't miss a thing. And whilst you're doing that, I'll see you in the next one.